Welcome to the Dental Business Expert Studio. It's my pleasure to host Timothy Brown, CEO of ROI Corporation, who is an authority and a leader in the dental space in Canada. Welcome, Timothy.
Thank you, Galia. Good to be back.
Yes, absolutely. So my recent article that I published, Choose Your Heart,
Mm.
talking about things that nobody dares to talk about in the industry, is that being a dentist practice owner is hard. Being an associate is hard. So let's talk about both sides of the story. I was on both sides. I was an associate before I purchased a pretty much startup, one chair old practice. And I was on both sides experiencing the difficulties being an associate and being a practice owner. I would like to listen and learn from you, your take on that.
Well, that one caught my eye. I read all your newsletters, of course, and all your publications, but choose your heart really caught me because that's what I do for a living. I help people decide to either be an owner or to not be an owner. For my clients that are ready to sell, they're choosing to no longer be an owner. And of course, all of the people that are buying are choosing to be an owner in most cases for the very first time. And all of the risks and the fears and the anxieties that they're first seeing about becoming an owner and no longer being an associate. So they're both hard. I don't think there's a perfect solution. And that's why I just think it's such a wonderful thing to say is choose your heart. So it's like as a dentist, you reach a fork in the road and you were there once. I've been there. I was an associate. I became an owner. You've reached a fork in the road. And my father always used to say, Tim, take it. He didn't say which way. He just said, take a fork, left or right, up or down. Being an associate, you don't have control. You don't have destiny. You don't have the profit, particularly from the hygiene program. You're not in charge of much. You should be in charge of your own treatment planning, but you're not really the boss. And that's hard for many associates. The reason being is that for most viewers, including you at one time, Galia, you all went into dentistry for one very important reason. And it's generally in the top three for all of you. Be my own boss. Most of you did not go to dental school to work for a corporation. You didn't go to dental school to work for the government like medical doctors do. So, choosing your heart is it's hard to be an associate, but it's also hard to be an owner. But Galia, you were an owner. What struggles did you have when you were an owner?
Yes, it's a good question. And I was an associate before purchasing a practice. And I followed your advice, Timothy, when you did a presentations at University of Toronto when I was a student. And I learned two things from you. Number one, if you want to be an associate for a few years, get your expertise and get mentorship, choose a place to associate away, miles and miles away from the place you want to practice and buy practice.
That's right.
So it's never a conflict. I followed that advice. Second advice that's really resonated with me, become an owner. Full 100% ownership of your dental practice. So that's rule. It was my purpose. And that's what I focused on, to become 100% solo owner of a dental practice eventually once I found a practice to purchase. So
Right.
my heart, when I stepped into the owner's shoes, on the day one, all the excitement is gone pretty much. Papers are signed, money's in the bank, and now you're the owner. And you're waking up every week thinking, where's the money to pay the payroll? Where's the money to pay the loan? Because if your insurance payments are delayed, even by a few days, you don't have enough funds on the account. But this is financial pressures that keep you at night. The other pressures is that every patient you see, you have to perform at the highest level. And it doesn't matter to the patient that is in the chair at the moment that you did a fantastic job on the previous patient. It doesn't matter to this patient. Every patient demands our expertise and high performance. So balancing that, and especially when you're a new practice owner, introducing yourself to the patients, every single patient is a new introduction when you step into the owner's shoes. So you have to have your act together. You have to be on the peak performance for every patient, because there they are as a loyal patients coming to the practice because you purchased a goodwill And let's say you had a fantastic introduction for the previous owner, but this single patient interviews you and sees, am I a right fit for this new owner? So this balance is it's quite stressful to maintain, and that was the most challenge for the first year since I became an owner.
So that transition from associate to owner, and make no mistake, ownership is where it's at. For every dentist watching, be an owner, get to ownership, become an owner. The control, the destiny, the profit, the sale price of the practice at the end of your career cycle is very rewarding. So there's many reasons to be an owner. But the heart of ownership, particularly in the early years, is managing human resources, managing cash flow, and all of those expectations that are thrust upon you, because all of those patients have a preconceived notion for decades in some cases of what a dentist is, how a dentist should be, and what their experience in the dental chair and the practice should be. So you are stepping into 1,000 new patient exams when you buy a practice, and they're all measuring you against their previous experiences. So that's hard. You're living up to previous expectations. You want to be your own individual. You're not the previous owner. You have the right as an owner to now make changes clinically or systematically in the administration of the practice, but the patients are accustomed to a certain style and a certain philosophy and a certain pace. So you have to go slow. And that first 1 to 2 years, you may not have all of the collections on time for the first of the month. And the first of the month is rent day for landlords, because most of you will be renting. And in many cases, that payroll falls right around the same time. And then that can be stressful. And you may have to dip into your credit card or your line of credit when you don't want to, but you might not get a paycheck sometimes in the months of your early ownership. You're not working for free. It's just a delayed pay, but sometimes you don't get paid. And most of us have a lifestyle to support: rent, mortgages, family, cars, iPhones, kids, you name it. So that's hard. That's not for everybody, but it's probably why a lot of you went to dental school, was to be your own boss. Tell me more about your experience, Callie.
Yes, my personal experience I shared in my book, in my dental business report. It was everything against everything happened to me in a transition, so to speak, is not what you taught us in U of T. You were saying was the ideal transition is such that the owner, previous owner, introduces you to the patients, introduces you to the staff, they mentor you, they help you to build authority and build trust with the patients, and then you carry on, right? You
Right,
have mentorship. In my experience, it was just the dentist left, I started. The
right.
first day, both employees blackmailed me. They came up to me and said, Dr.
What?
Anderson, I would like to have a raise. I'm gone.
I didn't know that. That
Yes,
happened to
it
you on
was
your first
hard.
day.
Receptionist came in to be, she's my office manager the first day. And then the second demand was, please sign a letter to my bank. I'm applying for a car loan and I need salary of such and such threshold in order to have a car loan. And here I am, like completely in the middle of the procedures and I'm already, overpaid employee, right? Then I'm just running around and thinking what I'm going to do. I called my lawyer and I said, what am I doing? He goes, well, pay her whatever she asks, win the
Wow.
patients, get comfortable. And then when the time comes, find somebody else, right? So, and then next day, CDA follows because they talk and CDA
Oh, yeah, they all
doubt what
talk.
I paid, right? That I signed the letter. Next day, CDA comes to me with the same request. And it was double of what market was. So 3 months later, they all were gone. They were all replaced by new loyal employees. So I really, really had a very tough start. And then the phone would never stop ringing for the first 3 months. Patients asking for the records to be transferred to my competition across the street. So that was tough. However, didn't kill me, made me stronger, right? And that's when I realized that no matter how expectation is, what it should be, you really have to be prepared what the worst, right? So then you actually can navigate through any challenges that you weigh.
Now,
But
I just want to say to all of those watching, that experience is not what all buyers experience when they buy a practice. That's an outlier. It happens. It has happened before. I've heard these stories. In some cases, I think the owner should be let go immediately. They should not stay. Some owners are past their prime. They shouldn't continue in practice. A new owner should come in and that owner should leave. There are certain dentists that shouldn't stay. There are other dentists that I think are wonderful in the transition. They care. They have family and friends in the practice. They genuinely are empathetic to the staff and they want them to stay. And they want you, the new owner, to be part of something that they built. So there are those transitions, which are the majority. But Galia, your circumstances about the staff holding you hostage and ransoming you for wages and salary letters and patients leaving, not common, but choose your heart because it can happen. Not often, but it can happen. So just know that when you transition from associate to owner at the fork in the road, there's a small chance that might happen to you. Good planning, good investigation should prevent it. But that's hard on anybody.
That's hard, absolutely. When I talk to younger dentists who are in associate positions
Mm,
and they honed their clinical skills, right? And they're high producers. And now they're basically restricted in what they can do in the practice because, as you mentioned earlier, you don't have no control. Yes, you do have control in your clinical expertise, but again, it's limited. For instance, I had a recent conversation with a brilliant dentist and practicing for a number of years and aspiring to do more cosmetic work. But because the owner did not want to spend any money on marketing, attracting the patients who are willing and able to afford cosmetic treatments, she never had a chance to prep for veneers, to do any smile makeovers. It was very limiting, right? And she has no control over it. So and obviously she wants to get out of the situation. Another dentist I talked to, it's a really sad situation, and it's perhaps exception. The the business owner, the practice owner, was cherry picking the patients.
of course.
They were sitting at the morning huddle, and the pile of the charts. This goes to me. This goes to me. That one goes to you.
Yeah. Emergencies, walk ins, uninsured, low income families. Yeah. Happens all the time.
This is for me. This is for me. This is for you.
Hmm.
Maybe. Right? So the dentist, almost in so much frustration, she says, I can do more. I can do better. I'm basically stopped. No matter how many courses I take to learn new skills, I cannot apply them. And if you're not practicing your clinical skills, how can you improve? How can you improve the speed of your clinical
Well, the
execution?
owners have rights. Ownership has rights and privileges. And as an associate, the owner is exercising his or her rights or privileges, whether you like it or not. They will do that. That's one of the hards of ownership, but it's one of the benefits of ownership. So, Gally, I know that in my book we talk a little bit about business tips. Do you have a copy of my book?
Yes, actually I do. I read
I
it.
don't have one with me. Thank you. It's free to anybody watching, by the way. So find Galia or I. We're all over social media, LinkedIn, free copy of my book for anybody that's watching. But this book is a collection of wisdoms of successful dentists. It's not me dispensing a bunch of nonsensical advice. It's a story of collections, a collective of successful dentists. Now, if you haven't already got the dental business report, and I'm sure you've got that there with you, hold
I
that up.
have. I have my
Galia
copy of my
wrote this.
dental
I took
business
it.
report.
I went on holiday in Barbados last fall in November. I took that with me. Wow. If you don't have her dental business report, get it. I do not offer the same type of advice that Galia does, and I'm very impressed. So, as an associate, choose your hard. Stay an associate, it's hard. As an associate contemplating ownership, choose your hard, but become an owner. It's hard, it's worth it.
Absolutely. Thank you so much for your wisdom and for sharing your expertise. And absolutely, cover to cover, I read this book in one sitting. Easy read, storytelling. You're sitting with Tim on his patio, drinking your favorite beverage, and he's telling you this story. It's amazing. The
Thank
same
you.
thing with me. I choose not to write the clinical book or business book. I chose to write it in the same style. It's a storytelling,
Yeah,
and
it's
that's
easy
what
read.
we really want to hear. And thank you so much, Timothy. I It's my honor to always meet with you and share your wisdom. Thank you
Thank you
so
so
much.
much. I'll see you in Vancouver in a couple of months.
Absolutely. Thank
Bye
you.
bye.